Another intermittent auscultation. So we usually do this every 5 minutes while the person is pushing, or if the primary person requests. I have a fetal heart rate of 140.
I can see the perineum bulging.
Okay. I'm going to document the time and the date.
You're doing such a great job pushing, Victoria. You just push when your body's telling you to. You're doing awesome.
The hospital will usually have a partogram that you would document on. But you can use any piece of paper if you happen to come in the room as the second.
I can see the head.
You can see the head.
Yeah.
So when your primary says that they can see the head, you should make sure that you have your oxytocin. It's already been drawn up by somebody else. It has the med label on it. You can get your alcohol swab ready. Your primary is going to let you know when the head is born. And you can make a note of the time of that.
Good job, Victoria. Head's almost here. Couple of more little pushes and just breathe your baby out. Good job. Straight away. Good job, baby. Head's born.
So the head is born at 12:46.
We're restituting to ROT. And one more push, Victoria, and we'll have a baby.
Once the anterior shoulder is out, you swab, active management, and let the primary know.
Little one.
Active management provided. 10 international units provided in the left thigh. Bring the baby skin to skin. Cover with a towel just to prevent heat loss. If your baby is quiet and hasn't taken any initial breaths, you'll want to do some stimulation. You can stimulate by flicking the heels, but often just drying will help. Sometimes babies are quiet and breathing, but not crying. In this case, our baby's not crying, but you can see that there's air entry. I can see the fetal heart rate is 140. There's air entry in both lungs.
Baby's crying. Good baby.
So while your primary is getting ready for the birth of the placenta, you can take a quick look at the baby, see if things are looking normal. You can also do a temperature. So you have to pull this out and there's a little cover. You put it under their arm.
I can see cord lengthening and
Perfect.
signs of placental separation. Oh, here comes the placenta.
Great. So while that's happening, you can record the birth time, which in this case was 12:47, and the placenta
Placenta is out.
is also at 12:47.
It appears complete.
And we gave the oxy at 12:46. Okay, once the placenta is out, you're going to want to provide some fundal massage. Your primary is going to ask you,
What's her fundus like?
her fundus is firm and contracted and central. And then she'll probably make a comment on the bleeding apparent.
Blood loss is very normal.
Perfect. Okay.
I'll give you the cord to clamp and cut. Let the partner clamp and cut.
So you'll want to be fairly close to the stump, but not so close that you're going to nick the skin. And you want it, depending on the sex of the baby, you want to guard regardless the genitalia and the skin. So you're going to clamp that.
There you go, partner.
And then either Victoria or a partner is going to cut. We need a second clamp, actually. There we go. So you'll have 2 clamps, and then the partner is going to cut in between the 2 clamps.
Perfect. Good job, Victoria. Congratulations.
Once the placenta is born, it's also the second's role to take a blood pressure right away for Victoria. You know that the bleeding is normal, but you'll want to get a set of vitals. So you'll set her up, and then there'll be an automatic blood pressure machine you can set it to every 15 minutes is typically what's done in the first hour. And then you just want to make sure that the baby's positioning. You want to monitor for sudden infant collapse in this first hour postpartum, but overall, you want to leave baby skin to skin and with the person who's just given birth, at least for the first hour, and support them with any choices they might have made to happen, such as breast crawl, breastfeeding, whatever the case might be. And then finally, you want to come back and do any sort of documentation updates. So I didn't actually write down that it was 10 international units of oxytocin and anything else that might be significant for documentation purposes.